ethics and professionalism. I think this is the most important aspect which we should all be aware of, that while we're coming from Pakistan, a different working environment, into the Ireland, a completely different working environment. So, Dr. Sohail, Rasool.
ونصلي على رسوله الكريم أما بعد أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Thanks Her Excellency Miss Faruqi and Brother Numan, all of the familiar faces. It's an honor to say welcome all of you to your chosen home. Your mother home is Pakistan, and this is your homeland to live and work. And as the Right Honorable Ambassador has said, you're lucky that you're coming to a good country. A country where the pitch has been set already for you. A country where there is a great perception of Pakistani professionals. A country which has common culture with Pakistani history. Australia, New Zealand, and likewise they understand that why these people are coming. As I was speaking to earlier, Ms. Faruqi, that we're all ambassadors. I'm no one to tell you how to do, because mind it that you have two eyes watching in front of you and two on your back. If I do a good thing, if Sohail does a good thing, it's a credit to all of the country. And believe you me, the department I work, they're very unfortunate countrymen who are locked up in the prison. If you do something bad, it's the same impression of all the country. No matter if you have a FRCS or MRCP or FCPS or whatever. For them, we're all same. It does not matter if you're a consultant or a junior doctor. For them, we are from Pakistan. And you know yourself, you all come from a good country. Three things you can't change in your life. One is your religion. Second one is your language, it's the binding force. And third one is your color. If I walk across Grafton Street or Connell Street, I represent my country. I represent my manners. I represent my profession. So mind it and be careful. As we had a short talk earlier, I can talk about this for ages, but I will leave my phone number with Dr. Numan. Anyone who wants to have a confidential advice, most welcome. Because I'm not doing something extraordinary for you. You deserve it. Because when I came here, we had only few doctors here when I was studying in Dublin, and they guided me. And now, mashallah, you are so many of you, and now you have bigger responsibility, not for yourself, not for the country, also for Pakistan. Because you are required back home eventually. The country is crying out for you. What you are doing is the work of Prophet sallallahu alaihi wasallam. The Prophet himself migrated. Irish migrated. Look at all the big people. There was one man who was the best barrister in London. He migrated. Why? Because he had a love to have a separate nation. He left his wife and daughter behind, if you remember this name. You just celebrated 14th of August. You see, this is more than medicine. So you have a better chance than people who are far better than me and you living back home. But they have no money to come here. You're lucky. You're lucky because you had good parents. Remember, if I'm a doctor, I'm not a doctor because of me. It's because of my parents. It's because of your good upbringing. And ethics, what ethics? Who knows better ethics than a Muslim guy? A good Muslim should always have better ethics. But this country has different standards and rules. We all have to learn that. And me and my colleague will be very happy to teach you, guide you. We are no one to teach you, but we can say, look, brother and sister, this is not the right way. Do this way. Because we deal with, and we have seen in the media, when the complaint process becomes public, forget about fighting for it. Because this is a small, beautiful country. If you cough here, we know there was a cold in Portlaoise, or there is a fever in liver. So that's why you have to go through and read the Irish Medical Contract Guidelines. Second thing, you have to look at your contract. What are your obligations? Punctuality, dress code, manners, how to learn to speak proper English, how to communicate with the patient, what is consent, what is confidentiality, what is GDPR. There are loads of things. We are tied up here. It's beautiful, but they have rules and regulations. That's why they're beautiful. And that's what we have to learn to invest back in our own country. So, I mean, like, I don't want to take much of your time. It's a pleasure, and Honorable Ambassador has given us this opportunity, and it's going to happen, inshallah, with the help of Allah subhanahu wa ta'ala, and with your help, that we will use this premises, which is your home. You have obligation to mind it, and we will continue setting some sort of a regular system through this organization and ourselves, that how we can help each other and how we help to raise the level and standard of Pakistani doctors which have been here and which is still here, and also to represent our country and our family and how to raise our children. I'm telling you, the most important and difficult job you will face will eventually be how to raise your children. It's easier when they're sitting in a lap. Mind you, and remember my words, when they are teenager, you will be wondering, is that FRCS or MRC, PFCPS good enough? No, it's not. You have to learn that art and learn from other nations. You know, I mean, you can still do a good job without saying anything. That's the art we have to learn, how we can act in a good manner without hurting someone's feeling. So I wish all of you the best of luck, and you will be successful because you have good parents, good grandparents, and good families praying for you. You're lucky, you know. But again, the time is to polish ourselves. I'm still learning, we're all learning. I still learn every day how to be a good person, which is not easy. All right, so I wish you all the best, and good to see you all. Thank you. All the best. Bye-bye.
Thank you so much, Dr. Sohail, for your kind advice, and very valuable advice actually. The only one thing I would reinforce is dress code. The one, like being politically right, I won't say how to dress up, but we in Pakistan we are used to wear jeans and go into hospital. That's something I would not do. Okay, they won't. Nobody will tell you in the hospital that what you are wearing, but they will talk behind you, and they will say that Pakistani doctor. Okay, so always they will say this, and believe me, recently people have come to me and asked me, does this thing happen in Pakistan? Does this happen this way in Pakistan? So sometimes we have to say, no, it doesn't happen like this. So